Vaccination is the best strategy against COVID-19. And when we're talking about COVID-19, we're really talking about mitigating risk. How do we reduce risk? No risk reduction strategy is perfect. And so we talk about wearing masks, we talk about washing hands, distancing, physical distancing. All of those things reduce risk. Vaccines reduce risk the greatest. They're the most effective at reducing risk. Masks reduce risk almost as well as vaccines do. And so the other strategies, the hand washing and the social distancing, add other layers of protection to those two biggies, the masks and vaccinations, in reducing risk. But we'll all eventually have to deal with the fact that risk will never be zero. And this virus is with us in the human population. It's not going to go away, and it's going to be with us for a long time. It will be likely not a pandemic, but become an endemic virus. That is, it will circulate on an annual basis, most likely, and continue to be a problem, especially for those who are high risk that we've already identified, elderly, those with underlying conditions and the like. Over the next at least several decades, we're going to be dealing with this virus. Any virus that we get infected with will educate our immune system, and our immune system has fairly good memory for long term. But coronaviruses, as a family, take advantage of a few weaknesses there. So what we've known for decades is that when we get infected with a coronavirus, our immune system can recognize it, but it doesn't develop really good memory of that coronavirus. And so that's really the difference that we're dealing with now between natural immunity from infection versus vaccination. And we know that natural immunity after infection wanes within 4 months, 6 months, somewhere in that range. It's going to be different for different people. But vaccine-induced immunity gives us not only a higher level of protection, but a longer durability of that protection. And those are the reasons, major reasons, why we want to still encourage folks to get vaccinated, because the protection is better overall than natural immunity. Yes, we know that COVID infection can occur more than once, and we've known that about other coronaviruses for a long time. With respect to the Omicron variant, we have reports out of South Africa that there are many cases where folks who've had COVID previously have gotten infected with the Omicron variant. Scientists all over the world are working to answer that question. The general feeling is that the vaccines will provide some protection, and we've seen already with the Alpha variant and the Delta variant that vaccine protection is less with those two variants than the original strain that started the pandemic. And the question now is, with the Omicron variant, will that protection be even less than it was for Delta and Alpha? We don't know the answer to that. Most of us are praying that it will be still very good protection. And the other piece of that equation is asking, what are we protecting against? What's the goal of the vaccine, right? And so one goal is to prevent transmission and infection. That's the societal goal. That affects the mass number of people. And the second, or the other goal, let's just say, I don't want to say it's less important, is actually the first goal of using the vaccines is save lives, prevent hospitalizations, keep our hospitals from being overwhelmed. All of those are different outcomes that the vaccine can provide for us. And so, again, where the protection against Omicron will fall on that spectrum of protection is not known. We're very hopeful that, and fairly certain that it will provide some protection, but how much, we don't know yet. We won't know that, like I said, for a few weeks. The Pfizer vaccine is available and recommended for children age 5 to 18. And the other vaccines, Moderna, J&J, and Pfizer, are all approved now for use in adults over age 18. And so only the Pfizer is available at this point, authorized for use in the pediatric population. It is recommended, and again, that's to reduce transmission in the community. We know we won't really be winning the battle against COVID-19 until at least 90% of the population in the whole world is protected against it. That's that herd immunity we've been talking about for a year and a half. And it's going to take at least 90% of us being protected to stop the pandemic phase of this virus. That's a challenge. We're nowhere near close to that yet. And what we're seeing out in our vaccine sites is very gratifying in the sense that, yes, teens and children are coming to get vaccinated, but we're also seeing adults who've been eligible for vaccine for almost a year now and older teens also coming to now get vaccinated. So they've reached their comfort level with time to see about side effects and any concerns or safety concerns folks have had. Time helps with that. And so we are seeing more people coming to start the vaccine series, which is good, which is what we want. Testing and vaccines are widely available in the community. Almost every healthcare provider can do testing. Pharmacies also can do testing. And vaccinations are also widely available, especially in local pharmacies. Our site on Linwood Avenue is open Monday through Friday from 10 a.m. to 6 p.m. And we are doing testing and vaccination all the way down to age 5 and up to 105 or more, and have testing there as well that's available Monday through Friday. So we're available in the community. It's a drive-through testing site, and folks, it helps if they pre-register, but they don't have to. They can register on site.